When we explore the biological and genetic foundations of violent behavior, scholars often first turn to the work of Cesare Lombroso, who is often referred to as the father of criminology. Lombroso believed that people born with traits that lead them to commit crimes have particular atavistic anomalies or physical characteristics typical of our distant ancestors. Lombroso also believed born criminals were cold and cruel, showed no remorse, and retained no close friends. Lombroso was an Italian physician and laid the foundations for the positivistic school of criminology. While most of Cesare Lombroso's work has been discounted by contemporary criminologists, scientists today are still concerned about the role of brain injury in subsequent violent behaviors. Considering that abuse is a common theme in the childhoods of serial killers, we must also be concerned with those who incurred head trauma as youths. Although head trauma may not directly cause violent behavior, the persistent correlation must not be ignored. Modern research also supports a variety of biochemical factors that may be involved in criminal behavior, such as allergies, environmental conditions, and diet. Also, the role of neurobiology in violent crime is of growing importance in understanding the dynamics of the interactions among the forces of biology, psychological factors, and our environment. Considerable attention has also been given to chromosome studies attempting to link an abnormal number of Y chromosomes in men to violent behavior. And there is literature which suggests that extroverted individuals, because of biological differences in their nervous systems, tend to be more involved in antisocial behavior. This is interesting, especially considering that some serial killers, such as Ted Bundy, have been viewed as being very charismatic and socially competent. It is important to mention that serial killers tend not to be legally insane. The McNaughton rule is used in about 16 states within the U.S. to determine whether or not an offender had an ability to distinguish between right and wrong as a result of mental disability at the time of the offense. If it can be demonstrated that the offender could distinguish between right and wrong, then he or she cannot be found to be insane. This is a very high legal threshold to meet, and perhaps this is why, in less than 1% of all criminal cases, the defendant uses the not guilty by reason of insanity defense. The vast majority of these defenses are not successful. Serial killers, unlike mass murderers, also tend not to have a history of mental illness. Serial killers, in most cases, tend to be suffering from a defect of character rather than a defect of the mind. If we turn to the case of Herbert Mullins, we can see a case where a serial killer unsuccessfully mounted a not guilty by reason of insanity defense. From 1972 to 1973, Herbert Mullins murdered 13 people between the ages of 4 and 72. His attorneys maintained that Mullins was hearing voices in his head. The voices were telling him that an earthquake was imminent and that only through murder could he save California. Mullins' birthday was also on April 18th, which was the anniversary of the 1906 San Francisco earthquake, which he felt was very significant. Incidentally, more than 3,000 people died in this San Francisco earthquake. Apparently, Mullins believed that in order to forestall a similar earthquake, there would need to be a blood sacrifice. Therefore, he began to kill people. His first victim was a homeless man whom he beat to death with a baseball bat. Mullins would next kill a female college student who was running late for a job interview. Then he killed a priest. In fact, Mullins alleged that he believed the priest was volunteering to be sacrificed. He would later go on to kill 10 more people. So the question is, was Herbert Mullins genuinely suffering from a mental disease which caused him to have a severe break from reality? The late Robert Ressler, who is a famed FBI profiler, asserted that Herbert Mullins had paranoid schizophrenia, which manifested itself as early as Mullins' senior year of high school. Mullins was also a habitual drug user, and Ressler also suggested that the use of cannabis, LSD, and amphetamines possibly accelerated his mental illness. Of course, there have been cases where serial murderers have attempted to fake mental illnesses in an attempt to be treated leniently by the court. For example, Kenneth Bianchi, who was one of the Hillside Stranglers, revealed that he had another personality, and he was even able to successfully deceive 2 mental health experts that he had multiple personality disorder. Eventually, Bianchi was caught faking his disorder and dropped his plea of insanity, and would later admit guilt for the murders of several young women. There do not appear to be any well-documented cases where multiple personality disorder has been found in apprehended serial killers. The layperson is typically not able to differentiate between psychopathy and psychosis, even though these are two very different concepts. An individual who suffers from psychosis has a break from reality caused by a severe mental illness. The good news for this person, however, is that mental illness can be treated. Persons with severe forms of mental illness can be given psychotropic medications which can help them immensely. Interestingly, though, psychopaths are not amenable to treatment because they do not believe they need it. Psychopaths have a constant need to be in control of their social and physical environment, and they derive a sense of power from controlling the behaviors of others. They lack remorse or guilt and do not accept responsibility for their actions. Psychopaths are impulsive, irresponsible, and have a constant need for stimulation, as they are often prone to boredom. And psychopaths have an inflated sense of self-worth. They are narcissistic individuals who constantly need to be praised by others. Many forensic psychologists maintain that criminal psychopaths are not likely to be reformed through treatment because these individuals simply do not believe that they need it and that they are above it. And if psychopaths are subjected to treatment, they will simply add that information to their arsenal of psychological tools that they can later use to control others. The term psychopath seems to apply well to serial killers, though it is admittedly a catch-all label. But serial killers tend to express themselves through the omnipotent control of others. Psychopaths also tend not to worry or have anxiety about the future. They often become adept at psychological game playing and learn to become proficient at controlling their immediate environment. Obviously, emotionally healthy people do not need to control others because they are already in control of themselves. People who feel good about themselves do not kill others. The better a person's self-concept and the higher an individual's self-esteem, the less need he or she has to control and dominate others. I think it is again worth mentioning that the term psychopath is a non-diagnostic label used to describe a potpourri of individuals determined by societal standards to possess characteristics at variance with general community standards and practices. Anyone who is a parent might wonder whether or not their child is at a high risk level of hurting other people. When we look at the childhoods of serial killers, we see that they are varied and complex. Some serial killers as children were more aggressive and more manipulative than other children. Yet similar characteristics can be observed in children who never grew up to become violent offenders. Children also react differently to stress. Because some children do not possess the same coping skills to deal with life stressors, some kids are at a greater risk of developing inappropriate behaviors. Psychopathology during childhood can be manifested in a variety of behaviors, some of which are more noticeable or detectable than others. Interestingly, serial killers have been linked to childhood maladaptive behaviors such as torturing animals, chronic bedwetting, and fire setting, which is referred to in the literature as McDonald's triad. Bedwetting, also known as enuresis, can be embarrassing as well as frustrating for children. For approximately 80% of children who suffer from enuresis, the major causes have biological roots and heredity is a contributing factor. In these cases, medication can be given to the child, which reduces the amount of urine produced and often eliminates the problem. However, for about 20% of children with enuresis, it is an indicator or a red flag of something more serious. In these cases, bedwetting may be considered to be an overt manifestation of inner turmoil caused by a disturbance in the home. As we examine this issue of bedwetting, let us turn again to Kenneth Bianchi, who we know was deeply troubled from a young age. Bianchi had an extremely overbearing adoptive mother who was known for taking him to the hospital. She first took Bianchi to the hospital when he was only 3 years old for not being able to sleep and for wetting the bed 5 times. Most of us would agree that this was an overreaction on the part of Bianchi's mother. In fact, after visiting with both young Bianchi and his overbearing mom, one doctor is said to have scribbled in the margins of his report, "Mother needs help." Apparently, Bianchi's urination problem persisted. At age 8, Bianchi began to urinate so much that his mother would even make him wear sanitary napkins. As a young boy, Bianchi would become visibly upset in the presence of his mom, and she continued to take him to the doctor's office because of his urination problem. And doctors examined his genitals in an attempt to diagnose the issue, which may have caused him quite a bit of embarrassment. Other serial killers, such as Henry Louis Wallace, also had problems controlling their bladders as children. As a youngster, Wallace, like Bianchi, also had a very overbearing mother. In fact, she was outright abusive. While we can safely characterize both Henry Louis Wallace and Kenneth Bianchi as psychopaths, it would be fair to say that Ed Gein is most likely a serial killer who was not in touch with reality. Though he committed his murders in the mid-1950s, no American serial killer has inspired more fictional murder movie characters than Ed Gein. Like Henry Louis Wallace and Kenneth Bianchi, Ed Gein also had an overbearing, controlling mother. Gein was raised by a very religious, strict mother who taught him that women were nothing more than prostitutes and instruments of the devil. To make matters worse, his mother punished him whenever he tried to make friends. So Gein, as a youngster, was devoted to making his domineering mother happy, who was rarely pleased with him, believing that Gein was destined to become a failure or an alcoholic, much like his father. After Gein's mother passed away from a stroke, he would find himself all alone. He had an unusual sense of attachment to his mother and was devastated by her death. Gein closed off most of his house and boarded up his mother's room. He would eventually make dozens of visits to local graveyards and exhume at least 10 graves of women, including his own mother. He began collecting body parts and fashioning them into household items. Gein would later kill at least 2 female store owners, and from these corpses he would make keepsakes such as suits and masks. After Ed Gein was apprehended, he was arraigned on 1 count of first-degree murder in 1957. Gein was found to be incompetent to stand trial and sent to a mental institution where he would be diagnosed with schizophrenia. Today, some criminal defendants can still be declared by courts to be incompetent to stand trial. However, very few serial murderers have been found to be incompetent. Gein is one of the rare exceptions. Eventually, Ed Gein would be found competent by medical experts to stand trial. After a week-long trial, Gein was found guilty of first-degree murder. However, because he was legally insane, Gein spent the rest of his life in a mental hospital. When examining the criminal cases of various serial killers, Gein is a rare outlier of a serial murderer who more than likely had a severe break with reality. We should remember, however, that Gein is the exception rather than the rule. Most serial murderers have defects of character rather than mind. They are psychopaths and very seldom actually experience any type of psychosis.